Good morning, everybody. I just wanted us to get together and make a quick video about what's going on with the Highway 61 construction project through Grand Marais. Let everybody know that it's coming soon and what they can expect. So we just have a few questions that we wanted to run through. Well, first of all, who are you guys?
I'm Ed Welch. I'll be the construction project engineer representing MnDOT throughout this job.
And I'm Andrew Deming, in a new role as the resident construction engineer out of the Duluth construction office. First off, Ed and I are obviously working from home now, and our whole construction inspection staff for about the last month has been working from home, teleworking to do our best to social distance ourselves. And during construction, that's going to be our main focus is social distancing for our field crews. For heavy civil construction projects, being outdoors, that kind of lends itself to social distancing. So we're asking the contractor crews and our folks to be mindful of that. Try to keep a 6-foot distance between yourself and anyone else as we proceed through the project. And now with COVID, we're holding all of our meetings via teleconference or Skype or conference call. Ed will be holding construction meetings weekly with the contractor. Typically, those are held in our construction field trailers, and you might see that those will be held outside now, so we can keep social distance between ourselves and others, and we'll also limit the amount of people who are attending those weekly construction meetings. As Ed was saying as well, we're hoping to have public meetings weekly where business owners and members of the public could come and ask us questions. We're now going to try to set that up so we can hold those online so we can still answer people's questions, but social distance and not try to have people gather in one spot. MnDOT also is providing sanitizing solutions for our construction inspection staff, hand sanitizers and cleaning wipes so they can keep their areas clean. And then also the CDC is recommending the use of cloth masks. So you may see some of the construction folks wearing masks if they're doing a operation where they're not able to social distance. So those are the steps we've been taking. Also, we talked about the field trailer. Typically, that's a meeting spot for construction staff, and with COVID, we're asking that to limit the amount of people in our field trailers. And also our construction staff, the inspectors on the job, will be working primarily from their trucks if they're not out in the field. So really the big thing that we're pushing is to, we have the sanitizing solutions, but the big thing we all can do is to social distance as best we can.
Do you anticipate any changes in expense due to the necessities that are brought forward from protection, COVID-19 protection? And also, do you foresee any kinds of anything that could happen politically or legally in the coming this summer? Basically, is what I'm mostly concerned about. That would change the construction schedule significantly.
I don't foresee any additional expense to the project related to the pandemic. A schedule delay, I don't see a risk there coming from a political aspect. The governor has made construction workers essential. So, MnDOT is proceeding with our projects as scheduled. And one thing that we don't know, it's a possibility, but if a construction crew were to be sick and would have to stay home, a scheduled delay is possible. Obviously we're doing our best to keep everyone safe, keep everyone healthy. But if that were to happen, a delay is definitely possible this summer.
Is there any kinds of, I know you guys have a sick policy and all that sort of things. Have you been implementing any changes to the sick policy? Whereas if workers don't have, or if workers have a fever or they are showing any signs or symptoms that they then cannot come to work, or what kind of protections do we have?
Our policy is if you're sick at all, whether whether it's COVID or not, is to stay home. So we'll have an inspection staff anywhere between 4 to 7 folks. And what we've told our staff is if you are sick, don't report to the project.
Mm-hmm.
If someone is sick and their doctor through the healthcare system, it's either suspected or confirmed that they have COVID, they'll be quarantined, and I believe the self-quarantine is for 14 days. But the inspection staff on this project, as it sits currently, this will be the project they're working on. If all goes well, we are not swapping staff out from project to project.